patient today is Lily Johnson, a 14-year-old female with a history of cystic fibrosis and is hospitalized for pneumonia. She comes to us today for a referral for cystic fibrosis related nutrition evaluation as well as her unintended weight loss. Lily reports her food and nutrition related history as follows. Her breakfast is rarely anything at all. Usually she has nothing. Her lunch is usually a sandwich with either peanut butter or ham and cheese, as well as chips and some sort of fruit on the side. And her dinner is the usual kind of meat, vegetable, and starch of some sort with maybe some margarine or dressing on the side depending on what she's having, if it's going with the veggies or going on the starch. She reports her 24-hour recall as having nothing for breakfast. She had a 2-ounce hot dog on a bun for lunch with 1.5 cups of mac and cheese, as well as a dinner of a 5-ounce Salisbury steak with a 1/4 cup of gravy, bites of her green beans, a roll, and 2 tablespoons of margarine and 2 cups of grape juice. She reports that she's been having some diarrhea, especially with fried foods, and that she has recently increased her activity. She used to run 3 to 4 miles 3 to 4 times a week, and she's upped that to 5 to 7 miles 3 to 4 times a week, as well as dance classes 3 times a week. So she's a very active teenager. She indicates she's had some previous medical nutrition therapy related to her cystic fibrosis, but she mostly hasn't been paying attention. Her parents have been the one that have been controlling her food and her intake for the most part, but now she's interested in moving forward and self-managing her disease for herself. So looking at her weight history, she's currently 102 pounds, or about 46 kilograms. And about 3 months ago, she was 110, 115 pounds. A BMI really isn't appropriate for this child at the moment. She's only 14, so we put her on a growth chart. And looking at the percentiles, her height is at the 50th percentile, which is good, and her weight is at the 25th percentile. 3 months ago, her weight was about at the 50th percentile as well, so she's dropped a major percentile, which is not recommended. And actually, for patients with cystic fibrosis, it's recommended that their weight and height be kind of maintained at that 50th percentile or above for the best outcomes for the patient. So just a quick review of what cystic fibrosis is it's a genetic disorder that results in the production of the thick, sticky mucus versus the thin, kind of lubricating mucus that most people have. So this thick, sticky mucus is produced in the lungs, in the pancreas, even in the digestive tract as well, resulting in things potentially getting caught, slow movement through the digestive tract, lack of production or adequate production of pancreatic enzymes that can digest fats, and especially in the lungs, they're more prone to lung infections because anything that's potentially aspirated or bacteria that gets caught in there is more prone to get stuck and potentially develop into an infection, which is the reason that Lily is in the hospital today. She has pneumonia, which is inflammation of the lung tissue, either due to some sort of infectious agent, and many times it can actually be due to aspiration of some sort of dental debris that gets caught in the lungs as well. So her home medications, she's on pancrease, which is a pancreatic enzyme replacement. She takes 1 to 3 capsules of that a day with her meals. She's also on Prevacid, which is an antacid, Humabid, which is an expectorant, which is used to help kind of thin out that mucus in her lungs and help her kind of cough it up, basically, as well as a multivitamin, which she admits to occasionally forgetting to take, and Provento, which is a bronchodilator. It comes as an inhaler. Since she's been in the hospital, she's been on vancomycin to treat the pneumonia, which is an antibiotic, and she's on a D5 drip at 50 milliliters an hour, which is, of course, we all know, is a carbohydrate infusion to kind of give her a little bit of energy. As far as we know, her skin status is intact. It wasn't reported otherwise. The patient's history, her great aunt had a history of cystic fibrosis. Her grandmother had type 2 diabetes, which is just something to keep in mind, as she might be a little bit more prone to diabetes that evolves from the cystic fibrosis due to the dysfunction of the pancreas. And then the patient, of course, has a history of pulmonary infections related to her cystic fibrosis. And to help prevent that, she is on a chest compression vest 1 hour, 2 times a day, which is basically, it's a vest that vibrates to help kind of pound the mucus out of those crevices in your lung and loosen it up so that it can be moved and not get caught and catch any sort of bacteria in there. So moving on, her estimated needs are complicated. Her calories, we want to calculate using catch-up growth. So to calculate her catch-up growth calorie needs, I use an ideal body weight of 115, which is where she was before. We want to get her back up to that 50th percentile at least. And then I used it for a healthy patient that's growing at the right velocity, a 14-year-old female. The Texas Children's Hospital Pediatric Nutrition Guide recommends a 47 calorie per kilogram for their caloric needs. But given she has some catch-up growth, we calculated it to be about 53 calories per kilogram, which gives us 2,500 calories a day. Her protein needs, again, is a recommendation from the Texas Children's Hospital to be 2 grams per kilogram, and that is based on her actual weight. We don't want to overfeed her protein right now, so we're going to use her actual weight for that, which was 94 grams of protein per day. And her fluid needs I used based on 1 milliliter per calorie, and I used a range of 2.5 to 3 liters of fluid per day, just given the fact that she's so active, she's probably losing a lot of fluid. So we want to give her a good buffer range to kind of make sure she's getting enough daily. Her current diet order is regular as tolerated. And she's also getting a little bit of calories from her D5 infusion, about 200 calories. She is, as far as we know, she's independent feeding ability. She doesn't have any chewing or swallowing issues, and her intake looks fair. She's eating, a small lunch, absolutely no breakfast, and it looked like her last dinner was pretty small as well, with only bites of her side items and about 5 ounces of protein. So it's not looking very good at the moment. So looking at her nutrition diagnoses, I diagnosed her with inadequate intake related to food and nutrition related knowledge deficit concerning the appropriate oral intake for her increased needs and energy expenditure related to her cystic fibrosis. As evidenced by the patient's reported increased her running and activity per week without increasing her calorie intake. Also her 8 to 13 pound weight loss in the past 3 months, which is 7 to 11%, which is a significant weight loss. And her dropping from the 50th percentile down to the 20th percentile for weight, as well as her reported lack of nutrition-related knowledge for cystic fibrosis. The other problem I diagnosed her with was impaired nutrient utilization related to cystic fibrosis, pancreatic enzyme deficiency, and fat absorption, as evidenced by her reported diarrhea when she has high-fat foods, and the patient being unable to identify how much pancreatic enzyme to take and dose herself with for her meals. She gave a pretty big range of 1 to 3, but it looks like she might need a little bit more given she's having that diarrhea with her meals. So her recommended nutrition prescription is a liberal salt diet, which is about 4 to 6 grams a day. Because she's excreting so much more salt in her tears and her sweat, especially because she's so active, we want to make sure she's getting a lot of salt in her diet. Also, we have high calorie, about that 2,500 calories a day, which is a lot for a 14-year-old. high protein, around 95 grams a day, and very frequent meals. I'll make sure she's eating enough, and it's going to be hard to meet her needs in just 3 big meals each day. So her food and nutrient delivery is going to be through meals and snacks. Of course, it's energy modified, protein modified, and mineral modified, given we have the high calories, the high protein, and the high sodium as well, the 4 to 6 grams a day. Her nutrition education is going to be, nutrition and its relationship to health as far as cystic fibrosis and diet go. Recommending modifications as far as, increasing her salt intake, making sure she's getting enough protein and enough calories each day, and then her skill development, looking at her pancreas dosing with meals, taking vitamins daily, identifying nutrient-dense foods and incorporating those into her usual intake. As far as counseling goes, we want to set some goals for weight gain, and if she's not meeting those goals, we'll definitely have to adjust her calorie intake. So we want to look at, her intake and her weight gain. So is she eating regularly, and is she going to be gaining weight? And then as far as problem solving, how she can increase her intake daily, it's going to be a huge jump for her to try and meet those 2,500 calories. So how is she going to do that while she's, staying active? So we want to counsel her on, adding snacks, things that are portable for her to take with her and eat between activities, as well as, not skipping those meals, and how vital starting out with breakfast would be for her. So the goals for this patient are that she gains weight and she gets to the 50th percentile or above. We want to see her intake meet her calorie, protein, and sodium needs. We want to see increased fat utilization, as well as improve the patient's skills and knowledge of nutrition and health and how that relates to cystic fibrosis. So for the criteria for meeting her goals, she's going to have a weight gain of 1 to 2 pounds a week until she's up at the 50th percentile again for her weight for age, or above that. We also want to see for her meeting her increased needs, in her diet recall or her food journals, however she's going to record this, indicating that she's meeting 100% of her needs daily, and she's having the appropriate weight gain that as indicated on the growth charts. We want to see the patient taking an increased amount of pancreas with every meal to decrease the instances of diarrhea and GI discomfort, as well as the patient to incorporate nutrient-dense foods into her meals so that she can meet her needs. We want to see her being able to choose those on her own as far as her skill development goes, and increasing her knowledge. We want to see regular meals, regular snacking, no skipping. We want to see that patient's intake reflect the recommendations we've made with the high calorie, high protein, and high salt diet. And also we want to see, if it looks like she really can't meet her needs, how can we supplement that? Like, if we can't meet her needs through snacking and meals, we want to look at potentially supplementing with some sort of, a shake or something like that she can have with her as even a meal replacer if she can't get a meal in between her activities. This is a very, very active 14-year-old. So that's something we're going to keep in mind as well. And these are the references below here, and this is just the growth chart you can look at real quick. So you can see that, she has dropped a major percentile in just 3 months, and that's not good at all. So we want to make sure we're adjusting for that. And that is Miss Lily Johnson. Thank you.